Hi everyone, I am Dr. Sagar Sahu and welcome to Vet Surgery I Teach. So today we will be solving the OPSC 2017-18 Veterinary Science paper. In this year I appeared the OPSC examination and then I got placed. Okay, let us start our paper. So first question, complex symmetry occurs in bacteriophage. They have complex symmetry. Okay, the head is icosahedral and the tail is helical. That is why they have complex symmetry. But this is not the answer, because all the bacteriophages does not possess the complex symmetry. TMV, the tobacco mosaic virus, they have helical. Influenza virus, they also have helical. The pox virus, all the pox virus don't have any symmetry. Okay, so the answer is pox virus. Okay, and another thing you remember about pox virus, they are ovoid shapes or brick shape. Okay, the answer is pox virus. Type of lenses employed in electron microscope are they are not like made of glass, they are made of electromagnetic fields. Okay, in electronic optic lens they are known as. Latency is a typical feature of herpes viridae. Okay, there is another also cytomegalovirus which has the feature of latency. Father of microbiology is Antony von Leeuwenhoek. Okay, he called the microbes as animalcules. Animalcules. He discovered protists and bacteria. Okay, so he is known as father of microbiology. Next question, antiviral activity of interferons is because they destroy the RNAs. Okay, by that they decrease the protein synthesis. Okay, so from RNA the protein synthesis is known as translation. So answer is translation. One of the following is not a virulence factor of bacteria. Capsule, they help in evading phagocytosis. So this contributes to the virulence factor of bacteria. Next options. Let's see next options. Fimbriae or pili. Fimbriae or pili, it is essential for attachment. So they contribute to virulence factor. Enzymes, you know, all the toxins are nothing but the enzymes. Okay, so they contribute to virulence factor. Only the cilia is basically for motility. CAM test is employed for differentiation of streptococcus because they produce the CAM factor. The full form of CAM is Christie-Atkins-Mons-Peterson test. Okay, CAM test. Next, one of the following is not a property of bacterial plasmid. Okay, plasmid is nothing but extra chromosomal materials. Yes, they are double strands, they are circular, they replicate autonomously. Essential for survival of bacterium? No, they are not essential for survival of bacterium, but they possess some additional genes which escapes or which is responsible for antibiotic sensitivity, but they are not essential because they are extra chromosomal. But you see, this is a little bit controversial question, but the answer will be D. Viral genome are made up of, it may be RNA or DNA, but never both. Next, McFadden reaction is employed for, you know, this is a very classical question, anthrax. Okay, very classical question. The most common medium employed to grow fungi is abroads. Anything fungus is abroad. Type of vaccine with potential for reversion to, you see, there will only be reversion when you deactivate the virus or attenuate the virus. The answer will be attenuated vaccines. Bacteria that are motile without possessing external flagella. Vibrio and bacilli, they both have external flagella. Streptococci is non-motile. Spirochetes, they have periplasmic flagella. Answer is spirochetes. Unstained leptospiral organisms can be seen directly under the dark field microscopy. The major immunoglobulin produced during secondary immunoresponse is IgG. In primary, if the answer question will be primary, then this is IgM. Okay. Next question 16. Natural active immunity is acquired through colostrum is natural but passive. Vaccines are artificial active. Infections are natural active. Okay, answer is infection. The source of complement for CFT is guinea pig serum. One of the following is a thermoprecipitation test employed in diagnosis. Will Felix reaction is basically for rickettsial, and this one is a agglutination test. Ascolius test is the answer. It is employed for anthrax, and this is a precipitation test. Anton reaction is for leptospirosis, where infected organisms are placed in the conjunctiva of rabbit, and within 24 hours there will be conjunctivitis. Coombs test as for antiglobulin test is known as antiglobulin test for erythrocytes. Okay, antiglobulin test. Liver fluke damage is the predisposing factor for black disease. The other name of black disease is infectious necrotic hepatitis caused by Clostridium chauvi. Okay, the name is hepatitis, so predisposing factor is liver fluke infection. Next, which one of the following is considered as energy parasite? Energy parasite is chlamydia. Okay, answer is chlamydia. Next, the simple quantitative test used in the diagnosis of Brucella abortus infection is agglutination test, but the answer is the question is quantitative, so the answer will be tube agglutination test. I already told Coombs test for antiglobulin, which is in erythrocyte. IHA basically indirect hemagglutination test is known as IHA test. The specific regions on antigen, against which immune response are directed are called. Paratops is basically antigen binding site, which is a part of antibody. Okay, epitopes is known as antigenic determinant, which is part of antigen. The answer is epitope. Idiotope is not basically the paratope of epitope. Okay, reverse the epitope of paratope. Okay, this is known as idiotope. Antitope, after the proteolytic cleavage, the peptide is known as antitopes. Segmented RNA is seen in one of the following viruses. Influenza viruses, they belong to group Orthomyxoviridae. There is another family of veterinary importance which has segmented RNA is Reovirus or Reoviridae. Okay, if someone asks how many families are there, 11 families contain segmented RNA. They have a feature which is known as genetic assortment. Okay. Next question. Hemorrhagic infarcts are commonly seen in brain, lungs and GIT. Answer is lungs. Anaplastic cells show nuclear, this is basically cancer cells. Anaplastic cells show nuclear segment 1:1. Next question. In apoptosis, following features is absent. It is present chromatin condensation, formation of cytoplasmic bursts, yes. Cell not inflammation is not present. Answer is D, inflammation. The type of leukocyte commonly noticed in high numbers in parasitic infection is eosinophil. Neutrophil you will find in bacterial infections, lymphocytes in viral infections. Next question. The metal involved in wound healing, zinc. Okay. Many of the creams which are used for wound healing contains zinc. Another thing, this is iron, this is copper, cobalt. Okay, these three, then you will find a brand name Cofecu. Okay, Cofecu. Cobalt, iron and copper. They are used for treatment of infertility in animals, infertility. Grey hepatization of lungs is attributed to WBC infiltration. There are 4 stages of pneumonia. Stage 1 is known as congestion. Stage 2 red hepatization. Stage 3 is known as grey hepatization. Stage 4 is known as resolution. Remember the days, this is 24 hours or 1 day. This is 2 to 4 days, 4 to 6 days, 8 to 10th day. Okay, this is stages of pneumonia. Next question. Types of inflammation not seen in brain. In brain you won't find mucous glands, so the answer is catarrhal inflammation. Here you can see 4 types of inflammation. There are 2 more, which is basically serous and gangrenous. Okay. In fibrinous, the material is fibrin. Catarrhal mucus, purulent pus, which is basically dead neutrophils, hemorrhagic blood. Serous, you will find plasma, which is basically watery. Gangrenous, when they are invaded by saprophytic bacteria. Okay, then it becomes gangrenous. In gastric disease, the type of anemia, in gastric disease you will find vitamin B12 or cyanocobalamin deficiency. Under the deficiency of vitamin B12, the cells becomes larger, macrocytic normochromic anemia. White spotted kidney is characterized by focal interstitial nephritis, which is found in the disease leptospirosis. The parasite commonly seen in dog heart is known as diarrheal lymphitis. Very common question, diarrheal lymphitis. Onchocerca armillata and Strongylosis burghalis found in blood vessels. Spirocerca lupi in esophagus. They cause tumors. Esophagus. In ox, urinary calculi are commonly seen in sigmoid flexure or sigmoid curve. Okay. In bovines, the penis has a S-shaped curve. This is known as sigmoid flexure. Okay. This you can find stones lost here and here. Guide in sheep caused by Cineros cerebralis. Very common question in parasitology. Panthers, you see this question has already come in 2019-20 paper. If you have seen those videos, you will find this is a sequelae to foot and mouth disease. Panthers hypotrichosis, they are basically sequelae to foot and mouth disease. Button ulcers in intestine and torque. This is a classical swine feature of swine fever. And another thing, in swine erysipelas infection, which is caused by erysipelothric species, this is known as diamond skin disease. And you will find in pathology vegetative endocarditis. If you have been to our college, then you will find a sample in pathology which is vegetative endocarditis. Langerhans type of giant cell are the characteristics of tuberculosis. Which of the following lesion is found in chicks infected with velogenic viscerotropic? Velogenic means highly virulent. Okay, velogenic. Another one is mesogenic. Mesogenic is moderately virulent. Another is lentogenic. Okay, it means it is in latency, avirulent. Okay, in velogenic we will find 90% of mortality. It usually causes 10% mortality, and you won't find any much of mortality in lentogenic variant. So velogenic viscerotropic, it means internal organ. Newcastle disease virus, okay, ND virus. The answer is hemorrhagic ulcers in small intestine, and there is a classical sign which is the petechiae of the proventricular glands. This is pathognomonic, proventricular glands. Okay. Next question, question number 40. Name of the mycotoxin which is hepatotoxic. Ochratoxin is nephrotoxic. It injures kidney. Trichothiazide skin liver and kidney. Aflatoxin is liver. Answer is aflatoxins. Citrine, kidney. Nephrotoxin. Which of the following nutritional deficiency disease is associated with rancidity of polyunsaturated fatty acids? Poly is PUFA. Okay. Rickets, vitamin D. Encephalomalacia, vitamin E. Colto is riboflavin. And footpad is biotin. The answer will be encephalomalacia because addition of this rancid PUFA causes deficiency in vitamin E. This deficiency leads to encephalomalacia. Characteristic intranuclear inclusion in trachea. Tracheal epithelium. Fowl pox is intracytoplasmic. Remember, it is known as Bollinger bodies. Bollinger's bodies. Okay, ILT, infectious laryngotracheitis, is basically intranuclear and you will find in the cells of trachea. The body is cow dry type A. This is hepatitis, intranuclear cells in hepatocytes, intranuclear bodies in hepatocyte. Answer is ILT. Coli septicemia is caused by E. coli. Answer is perihepatitis. Along with you will find pericarditis and peritonitis. Okay, all pericarditis, perihepatitis and peritonitis. Next, cecal coccidiosis is caused by the Eimeria necatrix and Acerofalana is caused. They cause intestinal form of coccidiosis. Answer is Eimeria tenella. Eimeria brunetti cause rectal coccidiosis. Rectal. Next, anesthetic action of thiopentone is. I will explain detail in when I will go for the barbiturate answer in anesthesiology series. Answer is redistribution. In a log dose response relationship, the curve is linear, 20 to 80% response. I actually didn't find in book, but in internet I found this 20 to 80% response. Insulin receptors are categorized as, you see there are 5 types of receptors. First one is ionotropic. Second is metabotropic. The third one is tyrosine kinase linked. Fourth one is cytosolic. And the fifth one is enzyme. Okay, the insulin binds to tyrosine kinase. So answer is type 3 receptors. A muscarinic antagonist that is used a patch behind the ear for controlling CTZ mediated receptor trigger zone, CRTH actually. Apomorphine is dopamine agonist. Scopolamine, this is M2 antagonist. Answer is scopolamine. Prochlorperazine is basically phenothiazine. They bind to, if you have seen my phenothiazine class, they bind to dopamine alpha receptors, adrenergic receptor, and also 5-HT3 receptors and many other different receptors. Ondansetron is basically 5-HT3 antagonist. 5-HT3 antagonist. Okay. Next, the receptors present in skeletal muscle end plate. M for muscle end plate, N for the neuronal end plate. M1 receptors are found in the autonomic ganglia and brain. M2 basically found in heart. I already discussed when I discussed the anticholinergics. In anesthesiology series you will find this video. Last question of today's class. 50. One of the following is a potassium sparing diuretic. Mannitol is osmotic diuretic. Chlorothiazide, you see thiazide, they are thiazide diuretics. Amiloride, this is potassium sparing. Okay, caffeine has different functions. Okay, they have different modes in which they act as diuretics. So, question number 51. Action of growth hormone is mediated by somatomedins. Okay, somatostatins, statins means inhibition, so they inhibit the growth hormone, and the cyclic GMP and phospholipase C, they are basically the part of signal transduction. The antidote for heparin overdosage is protamine. Okay, this is the antidote for heparin overdosage. Warfarin and pinodone, they are basically present in rat killers. Okay, rat killers. And while there is poisoning of warfarin on pinodone, the antidote is vitamin K. Okay, next question. Question 53. One of the following is oral hypoglycemic agent. Insulin is injectable. Glycazide, this one is oral hypoglycemic agent. Carbamazole, this is antithyroid agent. Antithyroid agent. Prednisolone, you know, this is a glucocorticoid. One of the following is selective beta 1 blocker. Isoproterenol, this is non-selective beta agonist. This is non-selective beta antagonist. Atenolol is the answer, which is selective beta 1 blocker. Prazosin is alpha 1 blocker. Next question, question 55. The determinants of bioavailability are the absorption and hepatic phosphorus effect. Which is the characteristics of the intramuscular route of drug administration? Only water, no oily can be given. Yes, oily can be injected. Opportunity of hypertonic solutions are given intravenously. The action development slower by, this is wrong. Okay, it is faster than oral administration. The question 57 and 58, the options are intermingled. Okay, for question number 57, the options are in 58. One of the following is used for the treatment of fasciolosis. The answer is tricarbendazole. Praziquantel is for schistosomiasis. Parental is used for roundworm infestations. Levamisole is immunomodulator. Okay. Primary stain used in gram stain is lipid soluble. Okay. Gram staining has 4 parts. The first one is primary stain. Second one is fixing. Third one is decolorization. Fourth one is counter stain. Okay, the primary stain is the gram stain or crystal violet. Gram stain, also crystal violet. The fixing is iodine. Decolorization by acetone. Counter staining is fuchsin, or sometimes they use I think there is another one I am forgetting. You can check in books. Okay, so the primary stain, okay, is washed away by acetone, okay, which is a lipid solvent, special in gram negative bacteria. Okay, so the primary stain is lipid soluble. The glucocorticoid induced protein that targets phospholipase A2. Calmodulin is calcium binding protein. MX protein is antiviral protein which is activated by interference. Okay. Phospholambda, this one is a membrane binding calcium channel regulator, and annexin 1, this one is the glucocorticoid induced protein that targets phospholipase A2. The central neurotransmitter that is responsible, I have a doubt in this question because I didn't found any notes or any materials regarding the short term memory associated neurotransmitter. There are many neurotransmitters which are responsible for memory and learning. Among them, the most important one is glutamate. Then we will find dopamine, serotonin. These three are very important. Okay. Also, some articles will find acetylcholine also, but if you find any material regarding this, please let me No. 61. The period between the time of infection of the host and onset of clinical symptom is incubation period. Okay. Pre-patent period, infection to the demonstration. When the infection happen till you demonstrate the organism is pre-patent. The nematode egg that transmits blackhead disease, Heterachus gallinarum. Ascaridia galli is roundworm of fowl. Gongailamba, gullet worm. Syngamos trachea, these are common names. Okay. Syngamos trachea, gape worm. Also fork worm. Fecal egg count is method is done by McMaster method. Next question, 64. The following is called as stable fly stomoxis. Tabanus, horsefly. There are many names for tabanus, horsefly, mosca, face fly, or common fly. Sebaceous adenitis or acne is due to demodexy because they penetrate deep into the glands. 66. Chilicoides osteni acts as vector for blue tongue virus. These are direct questions. Classical vector for Theileria annulata Hyaloma anatolicum. Okay, Buphilus microplus is for babesiosis. Horse garbestor mosca. Garbestor is employed for mosca. Cox blue bodies are macrocygens. They are macrocygens of Theileria species. Okay, they are found in lymphocytes. Red water disease is synonym for babesiosis. Anaplasmosis, the synonym is gall sickness. Amastigote state is present Leishmania donovani. The laboratory reagent used for sporulation of Eimeria is 2.5% potassium dichromate. Maltese cross is seen in Babesia equus. Okay, Maltese cross looks like this. Maltese cross. Also, this is seen in Babesia microti. You will find some articles regarding this also. Parasite causes production of abnormal eggs in poultry is Prosthogonimous. There will be another option here, Prosthogonimous ovatus. In here you will find eggs without cells and also white discharge from cloaca. Neurocysticercosis is due to eating uncooked pork. Okay, if the salads are contaminated, then also you will find neurocysticercosis, but the most appropriate answer is eating uncooked pork. But in answer key, you will find both A and B. Drug of choice for snoring disease cystosoma is caused by Schistosoma nasale. The drug of choice is anthiomalin, but in recent articles you may find use of praziquantel. Next question, cell cure phenomenon is seen. This is a very common question. Haemonchus contortus. The fertile lifespan of spermatozoa is longest in cervix because it acts as reservoir of sperms. Here sperm stays for longest duration, that is why the fertile life is more. The prognosis of rare leg structural unsoundness is poor. Okay, once there is leg structural unsoundness, it will be very difficult to mount over another bull. Okay. Homosexual behavior is common in bulls, in bull farms. Bulbourethral gland is developed from urogenital sinus. Okay, from tubercle you will find clitoris, from swelling the vulva, from fold vestibule. Neighing is observed in stallion. This is vocalization. In ram you will find bleating. bleating. In boar it is grunting, and you won't find any kind of vocalization in case of bulls. Next, cowpox gland are well developed in boars. Okay, they contribute to seminal gel. Seminal gel is produced in pigs, and one of the major constituency is from the cowpox gland. The volume of semen ejaculated in, I don't know why this kind of questions are asked. From book to book you will find variation in this amount, okay, amount of semen ejaculation, and there is some dose range. The answer is 60 to 100 ml, okay, in case of stallion. In case of pig, 150 to 200 ml. In case of sheep and goat, I think it is 0.8 to 2 ml. Okay, and in case of cow, it is 5 to 8, I think 5 to 8 ml. Seminal plasma is slightly alkaline in case of boar. The spelling is wrong, B-O-A-R, boar. I think examiner was very much bored. Boar. Okay. Twinning is common cause of abortion in case of horses. Mare. The test used to diagnose for tubal patent is Rubin's insufflation test. Cuboni test is used in case of horses for pregnancy diagnosis, PD. Next, posterior presentation is more common in any multiparous animal. You will find common presentation as posterior presentation. Multiparous animal is sow. Ventral elevation of head is called vortex presentation. Vortex. Bridge presentation is bilateral hip flexion with posterior presentation and the dorsosacral position. Ideally, frequency of semen collection from bull is twice a week. Twice a week. The average age of attainment of purity. See, these kind of questions are controversial. Okay. The answer is 8 to 12, but it may vary. Okay, they are not fixed. Optimum breeding age in cows is 14 to 22 months. You see, this is not fixed one. From book and if you will see half piece, the thing will be different, and if you will follow different gynecology book, you will find different. Okay, so this type of question should be avoided. But what to do? Winking of clitoris is observed in mares, horse. Raspy, rough, nodular. This question is important because these are direct questions. Of vaginal mucosa is observed in cows affected with trichomoniasis. Viruses is basically Campylobacter infection. Here we will find leathery structure with edema of intercotyledony space. This is very characteristics for Campylobacter infection. Then brucellosis. In Campylobacter, you will find the abortion in 3 to 4 months. If you want to remember in a nicer way, in trichomoniasis, it will be first trimester. Vibrosis, not exactly second, but you can remember as second because from 4th month it is second trimester. Okay, and brucellosis last or third trimester. Last trimester, sorry. Last or third. Okay, 3, 6, 9. In last trimester, we find abortion in case of brucellosis. Postcoital pyometra is observed in trichomoniasis. These are direct questions. Trichomoniasis. Leukocytosis with shift to left is observed in bitches, pyometra. Okay. But see, in endometritis also, third degree endometritis is known as pyometra. They are interlinked. Okay, but the answer is pyometra. The dose of natural PGF2 alpha in the treatment of C. If we will go through the recent articles, there was an article in PubMed. I think it was published in 2017 or something, in which the natural PGF2 dosage was given as 250 microgram per kg. Okay, so 100 microgram per kg. Okay, answer key is 100 microgram per kg, but this dose varies with different articles. We will find different doses. the doses should not be asked unless it is very particular. The number of graphene follicles in cows during estrus is 1. The average number of follicles 3. Follicle in cow is 3. Theca cells are stimulated by LH. FSH stimulates granulosa cells. The last question. The time of ovulation. See, in answer key you may find 12 to 14, but if you will see the Happy's book, reproduction in hormonless animal by Happy's, the answer you will find 10 to 11 hours after ovulation. Okay, so these ranges should not be asked because it creates confusion, because the question setter might be following some different book according to which he might have given the answer key, but in the students who follow different books might answer with confusion. Okay, but whatever, we can't change it, so we have to face it. The answer is 12 to 14, but it varies. Question number 101. The flushing medium used for embryo collection is Dolbeck's phosphate buffer saline. In this, there is also addition of antimicrobials, mostly the antibiotics. Okay, and also 1% fetal bovine serum (FBS). Okay, TCM 199 is used for maturation of oocyte. Next question, 102. The embryo transfer technology. The embryos are collected after how many days of artificial insemination? 7th day. In the stage morula, but it is in a range 6 to 8 days. Hermaphroditism is common in goats and pigs, and is rare in mare and bitches. Less common in mares and bitches, and rare in case of cows. Okay, next question, 104. The dose of LH for treating the cow affected with follicular. You see, dose range should not be asked. Answer is 3000 to 5000. I found a very good article where the effective dose was 4500 IU. Okay, and let me tell you something about this article. In this article, he or she made 3 groups in which a single shot of 4500 IU was given. In the second group, 2 shots. Okay, 2250 like that, and here 4 shots. Okay, given so that they were measuring the effectiveness of the LH, whether single shot divided doses. Okay, they found all are same. Okay, but the dose range was 4500 IU, and if you are following the Merck veterinary manual, you will find the dose to be 10,000 IU to be effective. Okay, so dose range varies. Okay. Silent estrus is commonly observed in buffaloes. Next, the hormone responsible for preparing the uterine mucosa for implantation is progesterone. Pregnancy hormone, progesterone. One of the following is not a estrus detection aid. Teaser animal, yes. Ferguson reflex is not. I already taught you the stages of maturation in a video. Ferguson reflex is for release of oxytocin, which induces the myometrial contraction. Standing reflex is yes, visual observation. Eutosia is normal maturation. Okay, this is very common answer, normal maturation. The type of placenta in cattle is cotyledonary. Zonary type you will find in case of dog and cat. Discoid type you will find in humans. Diffuse in horse and pig. Cotyledonary in ruminants. In cattle, high milk yielders suffer from the following disease due to parathyroid. Parathyroid gland is responsible for calcium metabolism. Okay, so answer is parturient paresis. Ketosis is due to deficiency in glucose. Lactation tetany, also known as hypomagnesic tetany. So deficiency of magnesium. Eclampsia is also calcium deficiency, but this is found in case of bitches or dog. Okay, so here the question is about cattle. The drug preferred in the treatment of immature amphiostoma, you see, in answer key you will find the answer as rifaxienate, but in many of the articles, recent articles also, there is a study in Nellore where they used niclosamide at the dose rate of 100 mg per kg body weight, and they found to be effective for immature amphistomasis. Also, there is a research in Tanuvas where they used oxyclosanide at the dose rate of 18.7 mg per kg body weight, 2 shots at 48-hour interval. Okay, they are also effective for immature amphistomasis. So this is controversial, but in your answer key it is rifaxienate, but you can give oxyclosanide. In my opinion, it should be oxyclosanide. After the death of the animal, blood oozing out from natural anthrax, very common question. Dehydration can be assessed clinically in animals by skin fold test. Okay, or it is also known as skin tenting test. Okay, remember this one, it should be less than 1 second. Okay, I already made emergency and critical care video, you can check in the series principles of surgery. The disease state compounded of toxemia, hyperthermia and presence of large number of infectious microorganisms. You see here the definitions are very in strict sense. Fever means only pyrexia. So there you may find some infectious microorganisms circulating, but only hyperthermia, no toxemia. Bacteremia means only infectious microorganisms or infectious bacteria. This is a very strict sense. Toxemia means only toxemia. But in septicemia you will find all toxemia, hyperthermia and infectious microorganism. Okay, this is a very in strict sense. You can argue like in toxemia also maybe there is infectious microorganism, and also due to toxin there will be hyperthermia and only toxemia, but it is not in that sense. This is a very strict sense. Signs of recurrent tympani and gruel-like feces in cattle is seen in the following ruminal dysfunction. In acid indigestion and alkaline indigestion, you will find watery. Gruel means like soft cell, soft. Vagal indigestion, you will find this is a very characteristic scanty, soft, pasty feces. Pasty. Okay. And there is recurrent tympani. In vagal indigestion you will find recurrent tympani, but in this alkaline or acid indigestion you will find recurrent tympani. You will not find recurrent tympani. Answer is non-penetrating foreign body syndrome. I have already made a video regarding ruminotomy. Here I explained why there is recurrent tympani. Drug of choice in goats suffering with acid indigestion is sodium bicarbonate, intravenous sodium bicarbonate. Grunting in cattle, which is usually expiratory is traumatic reticulopericarditis, not exactly traumatic pericarditis, traumatic reticulopericarditis. The major clinical findings of pneumonia in early stage. In early stage you will find polypnoea, when last stage you will find dyspnoea. Dyspnoea is difficulty in respiration. Therapy of choice in bronchopneumonia of cattle is, they see oxygen, respiratory stimulant, bronchodilator are emergency medicines, and also they are short term treatment. Okay, short term. Antibiotics are long term treatment and their choice for therapy. Slab sided abdomen is seen cattle suffering from left abdominal displacement. Okay, see normally the abdomen should be like this. Here will be abomasum. When the abomasum will be shifted to this side, this will be enlarged and this will be slightly flat. Okay, so this will be slab sided abdomen in left abomasal displacement. Next, excess molybdenum diet of cattle causes enteritis, in which you will find the symptoms as greenish diarrhea. Also you will find infertility. Also you will find the lameness. Okay. Choose the mineral deficiency that causes chronic inappetence in cattle. It is cobalt. Copper, you will find reduced fertility. In zinc, all the skin lesions is due to zinc deficiency. Iron is about anemia. Okay. If you will see, earlier when there will be anorexia, you will find medications which is centrally active, but nowadays you will see containing the appetizer containing cobalt. Okay, you will, nowadays the boluses are coming for ruminants, cobalt, containing cobalt. Nyctalopia and xerophthalmia seen in hypovitamin degeneration of visual purple. Visual purpose is rhodopsin pigment, rhodopsin, light sensing pigment, rhodopsin. The therapeutic dose of vitamin A, you see, I have a doubt in this question. Okay, the normal requirement is 30 IU per kg per day. Okay, the normal requirement. If you know this dose rate, I didn't find in good articles where the dose rate of vitamin A was there, but you can comment down below. I know the answer is 440 IU, 125. The drug of choice in cattle suffering with potassium postpartum hemoglobin. Postpartum hemoglobinuria is due to phosphorus deficiency. Phosphorus deficiency. Okay, so you have to supply phosphorus. Calcium borogluconate is given in the case of milk fever, magnesium sulfate, hypomagnesium tetani. Also, it is given in downwards cow. In downwards cow, also potassium supplements should be there. And this is the answer, sodium acid phosphate. Petechial hemorrhage of mucous membrane is a common finding seen in cattle suffering from. It is a characteristic lesion of hemorrhagic septicemia. Next question. 127. Intravascular hemolysis of RBC is a common finding in pyroplasmosis, which is babesiosis. Okay, in trypanosomiasis and anaplasmosis, you will find extravascular hemolysis. Extravascular. Next, 128. Drug of choice for tapeworm infestation in sheep is praziquantel. Praziquantel, it is also drug of choice or preferred drug in for schistosomiasis. Schistosomiasis. Drug of choice for the theileriosis in crossbred cow is oxytetracycline is drug of choice for anaplasmosis. Anaplasma marginale, which is basically affects the cows. Quinapyramine sulfate is for trips. Dimnazirine acetate is for babesia. Also, it is also effective for trypanosoma, trips. Buparvacone is the answer, which is drug of choice for theileriosis. Animals that are considered resistant to tuberculosis are sheep. Acarodermatitis in animals is caused by acarology, the study of ticks and mites. Okay, so the answer is ticks and mites. Next question. Pups affected with canine parvovirus die due to mostly dehydration. In pups, you will find myocarditis. Dehydration and myocarditis. You will find a very good article in PubMed published in 2017 regarding the myocarditis or myocardial infection, myocardial action of this canine parvovirus. One of the following is an example of Wormian bones. Wormian bones means intrasutural bones. In brain, you will find sutures or joining of two bones. Sometimes, okay, between two sutures, a bone will ossify and it forms a bone. This is known as Wormian bone. Answer is interfrontal, between two frontal bones. Acromion process is at the level of glenoid cavity in the scapula of dog. And remember, the acromion process is absent in case of horses. A bone which develops in a tendon of a muscle is known as sesamoid bone. Sesamoid bone. Best example is patella. Patella is a sesamoid bone. Following large metatarsal bone of the horse is called cannon bone. Third, in horse you will find the metatarsal bone second, third and fourth. Second and fourth are basically splint bones. Third one is the middle one. In cattle you will find third and fourth. Costal facets are located on the following thoracic vertebra. Here the 1 to 13th dorsal thoracic vertebra. Costal facet is for the attachment of ribs. 138, keel is a prominent, this is a fowl, this is a very common question. I think there was a question in previous year questions also. Fowl. The following muscle replaces ventral longitudinal ligament in neck region, longus colli. Okay, longus colli. Large quadrilateral shaped muscle in the hip is quadriceps femoris. Quadriceps femoris. The apex of heart is located entirely in left ventricle. Okay, the heart shape is like that, and the septum runs like slightly oblique. Okay, so the apex will be at the left ventricle. This is right ventricle. Circle of Willis is formed from the branches of emergent artery which arises from rete mirabile cerebri. Okay, rete mirabile cerebri. These are basically blood circulations of brain. Next, femoral artery gives the following branch in the femoral canal, saphenous. In femoral canal gives saphenous. Tibial are the region of tibia or proximal tibia. Popliteal, you know, popliteal notch of the tibia. Deep femoral, it is given at the beginning when the iliac artery branches, it gives deep femoral. The nerve which supplies gustatory fibers to posterior 1/3 of tongue is the 9th cranial. Okay, 9th cranial. The 7th cranial gives the anterior 2/3. Anterior 2/3. Large venous trunk which drains blood from stomach and into portal circulation, portal veins. Recurrent laryngeal nerve is the branch of this 10th. 10th is vagus. 9th is glossopharyngeal. 11th, 10th is vagus, 11th is spinal accessory, and 12th is last one, VSH, hypoglossal. Okay, might have read UTA, FAC, VSH like that, you can remember it. Part of intestine which is festoon like jejunum. Okay, this is I think this was present in Tonuva's note. Okay, festoon like jejunum. It makes a curve over mesentery. That is why festoon means is a curve. Complete tracheal rings are seen in fowl. Area cribrosa is a feature seen in the kidney of the following horse. And remember the shape. The left one is bean shape, and the right one is heart shape. Okay, the shape of kidney in case of horse. The accessory sex gland present in dog is prostate. Okay, because seminal vesicle and cowpers are absent in case of dog. Hi everyone, I am Dr. Sagar Sahu and welcome to Vety Science. The 2017-18 paper from question number 151 to 200. The last 50 questions. Question number 151. Sigmoid flexure of the penis is post-scrotal in boars. Okay, in stallion and dog it is absent. In bull it is pre-scrotal. Okay, ovary is in the form of a cluster of spherical shapes or grapes. It is present as the shape as grapes in hen and also pig, but it is more prominent as grapes in hen in poultry. Okay. Next, 153. Lens of the eye develops from the following germline: facial ectoderm. Okay, both the neural and facial ectoderm are part of neural crest. The following structure develops into vertebra: sclerotum. Okay, rest of the things are self-explanatory: myotum, nephrotum, and dermatotum. Muscle, kidney, and the skin. 155. The cells which produce bile in liver are called hepatocytes. Produce bile. The embryonic cells are hepatoblast. From here produce they differentiate into hepatocyte which produces bile and cholangiocytes which forms the bile duct. Supporting cells of seminiferous tubules are called Sertoli cells. Kupffer cells are basically liver macrophages. Base cells are basically pyramidal cells found in brains. They are large neurons. Stem cells are found in spleen. They are special endothelial cells. Next question, 157. And the following is not correct about atropine sulfate. Reduces salivation, yes, this is M2 mediated, M2 receptor mediated. Reduces bronchial secretion, same M2 receptor mediated. Reduces heart rate, no, it increases heart rate. M1 receptor mediated, they cause tachycardia. Then they reduces intestinal motility, this is M2 receptor mediated. I have already taught you in anticholinergics regarding atropine sulfate. 158. Diffusion hypoxia may be associated with the use of nitrous oxide. This is a very common question in anesthesiology. The allergen causes bradycardia and second degree AV block. This can be prevented by pre-medication with atropine sulfate. Atropine causes sinus tachycardia. Okay, it opposes the bradycardia caused by gelazine. A wound with irregular tone edges is termed as lacerated. Okay, I have already made the video regarding wounds in principle of surgery. Okay, penetrating into the abdominal cavity, perforating entry and exit. Gunshot wound, they are basically made by the firearms or guns. The lower chain fatty acid present in milk has inhibitory effect on these bacteria, lactobacillus and also streptococcus. Next, dry gangrene affects, it usually affects the area where the vasculature is less, usually the extremities where the blood vessel supply is less. Next, 163. A double row of lumbar suture is called journey, CZE, journey. Rest you know, Cushing, Cornell, reinforce basically use of stents. Persistent vomiting causes, I have already taught you in this in the fluid therapy class. In persistent vomiting, chloride ioners are lost. Okay, it causes alkalosis, dehydration with alkalosis. The speed of local anesthetic solution in tissues can be increased by, when you will promote more absorption. Addition of hyaluronidase enzyme to the local anesthetic solution increases the absorption of the drug. The answer will be this. Why the not other? Addition of adrenaline causes vasoconstriction, so less drug will be absorbed. Addition of atropine sulfate does not have any effect. Increasing the concentration of local anesthetic. When the concentration of local anesthetic is increased, it may cause the local anesthetic toxicity. Okay, and also if the concentration is increased, then amount of drug required will be less. Vesicle formation is seen in this kind of bone injury first degree. There will be vesicles. Next, 167. Pentobarbital sodium is a long acting. It is a long acting barbiturate. Another example is secobarbital. Pentojoken is a non-narcotic analgesic. It is a synthetic opioid or opioid. Okay, narcosis means I have already taught you in anesthesiology. Deep sleep accompanied with analgesia or may not be accompanied with analgesia. Okay, this is a non-narcotic analgesics. Escape of blood from the blood vessels is termed as hemorrhage. Okay, hemorrhage. Hemangioma basically tumor of blood vessels. Okay. The upper lip and external layers on the corresponding side are desensitized by, I have already taught you in local anesthetic, infraorbital nerve block. Okay, infraorbital. The nerve where you have to give infraorbital nerve block, just anterior to the facial tuberosity. A drug in the state of deep sleep. Deep sleep is narcosis, hypnosis is only sleep, sedation is drowsy. When drowsy. Okay, general anesthesia, there will be reversible intoxication of CNS along with analgesia and muscle relaxation. That is general anesthesia. Dentigerous cyst is seen in the horses in the temporal region. Okay, there is abnormal teeth in temporal region. I have already taught you in cyst abscess and hernia. Extra chromic catgut gets absorbed. This varies from book to book. The book which I follow They are given 60 days. So, near to 60 days, 40 days. A fracture accompanied by break in the continuity of skin is termed as compound. If there won't any break, it is simple. Okay, the answer is compound. The site of injection for cranial epidural anesthesia is lumbosacral. Okay, see, this concept varies from surgeon to surgeon. Some prefer the sacrococcygeal to be the cranial epidural and first and second to be the caudal epidural. But many of the books you will find lumbosacral as to be the cranial epidural and the sacrococcygeal or first or second intercoccygeal to be caudal epidural anesthesia. Okay. 176. The topical anesthesia of cornea lignocaine is instilled at the concentration of 4%. Usually the availability is 2%, but for eye used as 4%. Forecast regarding the chance of recovery from a disease termed as prognosis. Diagnosis is basically method to diagnose a disease. Differential diagnosis means when there is similar signs and symptoms. So, differentiating between the diseases known as differential diagnosis. Sequelae is the result of a disease. After a disease, what happens? Sequelae. The filament in cathode of X-ray tube is made up of tungsten. Focal source are tungsten and rhenium. Morphine is contraindicated in felines. Hematosalpinx means fallopian tube. A linear accelerator machine is required to perform radiotherapy. Okay, they are used for cancer treatment. Okay, they are very useful in practiced in humans. Next question. Trichiasis means anything related to eyelash. Trichiasis. If there is any abnormal deficiency eyelid, entropion or ectropion. Okay. Eyeball you will find the term as squint. Operation performed for chronic otitis sector, very common question in surgery, Jeff's operation. A gamma camera is required to perform scintigraphy, diagnostic procedure, nuclear scintigraphy. Atropine sulfate at a premedicated in dose rate of 0.02 to 0.04 mg per kg body weight. Okay, 0.02. Next, Droyer sign in the dogs is associated with the disease of this is stifle joint. Okay, they are basically for diagnosing the cruciate ligament rupture. Cruciate ligament. Next, 187. Buttress foot is seen as a sequelae of pyramidal disease. Okay, this is horse lameness. Exostosis of phalanx is called ring bone. Ring bone can be the high ring bone or the low ring bone. High ring bone affects the pastern. Low is coffin joint, pastern joint, coffin joint. Boba bone is basically exostosis of first phalanx. There is a specific region also, I think supero and like that, supero and tero and internal like that, the surface. I am forgetting, but it is exostosis of first phalanx. Side bone is basically the ossification of collateral cartilage. Okay, this is known as side bone. Splint basically second and fourth metacarpal. Ossification of lateral cartilage is I already told the side bone. Hematoma means collection of blood in an abnormal cavity. The standards provided by BSA for milk and milk are optional. The standards are optional. Okay, it is not mandatory. Next, as per BSA standard, the SPC counts for pasteurized milk per ml is 30,000. The pathogenic organisms that contaminate milk from the milkers and milk handles. The common organism which found in skin is Staphylococcus aureus. 194. Microbial inhibitor used in detergent solution for cleaning of aluminum surface, metasilicate, sodium metasilicate. During decomposition of meat, a pronounced repulsive odor and an alkyl reaction takes place due to liberation of You see decomposition of meat, you will find denaturation of protein. When the proteins are denatured, they produce ammonia, gas ammonia. 196. Captive bolt system of stoning is less effective. It is effective in sheep and goats, less effective in cattle and pig. More appropriate answer will be cattle because they have thick frontal skull, okay, frontal bone. Food animals that are highly susceptible to transportation is pig because they do not have or they have less sweat glands. The air pollution surrounding electrical power plant is sulfur dioxide and nitrogen oxide. This is sulfur dioxide and nitrogen oxide, SO2 and NO2. The microorganism commonly used for the preparation of biopesticide is a very common question, Bacillus thuringiensis. The chemical used for regeneration of zeolite is sodium chloride, sodium hypochlorite solution, NaOCl. Okay, they are used for the regeneration of zeolite. So this is all about the 2017-18 paper. We have finished. See you, tata, bye bye.